Hello, you are going to learn how to use EOlife, which is developed by Archeon. This innovative medical device provides real-time feedback about the quality of manual ventilation during CPR, whether using a mask, supraglottic airway, or endotracheal tube. EOlife consists of an electronic system and a disposable sensor called FlowSense. The arrow on the sensor shows the direction of the inspiratory flow, and the sensor ends are shaped differently to ensure that the interface cannot be connected to the wrong end. To connect the FlowSense, hold its base firmly while inserting the part that has a notch into the connector ridge. Next, rotate it from right to left to clip in place. The sensor's design prevents the user from assembling the mask and bag the wrong way around. The difficulty with mask ventilation is maintaining a good air seal and avoiding gastric inflation. To do this, make sure the top of the mask is positioned centrally on the patient's nose, as leaks are common in this area. Position your thumb at the top of the mask and pinch the patient's chin to hold it firmly. Tilt the head back and use the jaw thrust maneuver to clear the airways. Switch EOlife on by pressing the on-off button once. The date and time appear on the screen. You can change these in the settings to make sure that the correct date and time are recorded for each use. The home screen allows you to select the patient's height, divided into 3 categories: small, medium, or tall. Then select the type of ventilation to be used: 30-2 mode to alternate chest compressions and ventilation, or continuous mode for uninterrupted ventilation. The main screen has 4 areas. At the top, you have access to the settings to change the patient's height and the ventilation mode. And there is an icon to rotate the screen and a runtime indicator. Below this, you can see a real-time measurement of the insufflated volume, tidal volume, and respiratory rate. In the middle, EOlife gives visual feedback about the ventilation quality. The bottom of the screen displays the alarms. During ventilation, the bar graph shows you whether the volume delivered is appropriate based on the patient's height. Orange means that the volume is insufficient. Green means adequate, and red means excessive. In continuous mode, EOlife gives you a visual countdown between each ventilation to guarantee an ideal rate. In 30-2 mode, the countdown function is not available. The person performing the compressions must tell you when to deliver 2 breaths. EOlife has a smart alarm prioritization system. See the instructions for more information. During continuous ventilation, if you do not follow the specified pace, EOlife will tell you that you are ventilating too fast or too slow. EOlife also warns you if the tidal volume is excessive or insufficient. If this is the case, adjust the pressure applied to the bag. EOlife also warns you if there is a leak. This can happen if the mask is positioned incorrectly, if the airways are obstructed, or when there is a gastric inflation. If you press the on-off button, a statistical report shows the percentage of ventilation within the recommended range, the mean respiratory rate, the mean tidal volume, the total ventilation time. From this screen, you can tap on the wrench icon to access the device settings. You can set the date, time, and language of the device. You can also choose the default interface, access the menu to export the data recorded, and view EOlife operating data. If you select the Simplified Interface, the numerical data about the insufflated volume, the tidal volume, and the respiratory rate will be removed and replaced by written statements, such as ventilate continuously, wait for 30 compressions. This interface gives you a simplified reading of your ventilation. It is designed for less experienced users. Switch off EOlife by pressing on the on-off button, then by tapping the confirmation icon that appears on the statistics screen. Make sure you switch off EOlife before removing the battery. You can now remove the mask and the bag, and then disconnect the sensor by pulling hard on the tab, while rotating it from left to right. Make sure you change the sensor between each use to avoid contamination between patients. Archeon thanks you and hopes you enjoy using EOlife.